Here's a detailed and structured explanation of Meloxicam, ideal for nursing studies, medical reference, or patient education. This includes all 13 points in depth and clarity. Meloxicam, complete drug monograph. 1. Basic drug information. Generic name Meloxicam. Drug class, nonsteroidal anti-inflammatory drug. Subclass, enolic acid derivative, oxycam. Available forms. Oral tablets, 7.5 milligrams. Oral sus 5 milligrams, 5 milliliters. Capsules, Vivlodex, 5 milligrams, 10 milligrams. Injection, IV, 30 milliliters for hospital use. Orally disintegrating tablets, ODT. Cumize ODT, brand names most widely used. Vivlodex, low dose for acute pain. Ingesso IV formulation for perioperative pain. Definition: Meloxicam is a prescription NSAID used to manage pain and inflammation in chronic rheumatologic conditions. It is especially helpful in diseases involving joint inflammation such as arthritis. It reduces inflammation by inhibiting the production of prostaglandins, chemicals responsible for pain, fever, and swelling. 3. Mechanism of action. Meloxicam inhibits cyclooxygenase enzymes, specifically COX-2, cyclooxygenase 2, primarily involved in inflammation and pain, slightly inhibits COX-1, which helps protect the stomach lining and maintain kidney function. By blocking COX-2, Meloxicam reduces the synthesis of prostaglandins in inflamed tissues, which leads to decreased pain, reduced swelling and inflammation, mild antipyretic, fever-reducing effects. Its selectivity for COX-2 gives it a lower risk of gastric ulcers compared to non-selective NSAIDs like ibuprofen or naproxen. Indications, uses, FDA approved, osteoarthritis, OA, joint pain, stiffness, reduced mobility, rheumatoid arthritis, RA, autoimmune joint inflammation, juvenile idiopathic arthritis, JIA, in children 2 years. Off-label, ankylosing spondylitis, mild to moderate musculoskeletal pain, post-operative pain, and Gesso 5. Contraindications. Meloxicam should not be used in hypersensitivity to meloxicam, aspirin, or other NSAIDs, history of asthma, urticaria, or allergic reaction after NSAID use, active peptic ulcer or GI bleeding, severe renal or hepatic impairment, perioperative pain in CCABG, coronary artery bypass graft, surgery, late pregnancy, 3rd trimester, risk of premature ductus arteriosus closure. 6. Precautions. Before taking this medicine, cardiovascular risk can increase risk of heart attack or stroke, especially with long-term use. GI toxicity. Use with caution in patients with a history of ulcers or GI bleeding. Kidney function. Use cautiously in elderly and dehydrated patients. Hepatic impairment. Monitor liver function. Pregnancy. Avoid in 3rd trimester. Drug interactions. Check for interaction with warfarin, lithium, SSRIs, ACE inhibitors, diuretics. Asthma history, especially NSAID-exacerbated respiratory disease. 7. How to use. Oral tablet capsule. Swallow with water. May be taken with or without food. Oral suspension. Shake well before measuring. Use dosing device provided. ODT. Place on tongue and allow to dissolve without water. IV Gesso. Administered by healthcare professionals in a hospital setting. Always use lowest effective dose for shortest duration to minimize side effects. 8. Dosing information. Adults, ROA, initial 7.5 milligrams orally once daily, max 15 milligrams once daily. Juvenile idiopathic arthritis, 2 years. Oral suspension, 0.125 milligram once daily, max 7.5 milligrams per day. Elderly patients, use lower doses, monitor renal function. 9. Misdose and overdose. Misdose, take as soon as remembered. Skip if close to next dose. Do not double dose. Overdose, symptoms, nausea, vomiting, abdominal pain, lethargy, drowsiness, GI bleeding, coma. Severe overdose may lead to kidney failure, liver damage, or seizures. Treatment, supportive, no specific antidote. Gastric lavage, activated charcoal may be used. 10. When to stop or avoid taking. Stop immediately and contact a healthcare provider if you experience chest pain, shortness of breath, weakness on one side, stroke, heart attack, severe stomach pain, black tarry stools, vomiting blood, swelling of hands, feet, or face, skin rash, itching, or peeling, e.g. Stevens-Johnson syndrome, signs of liver damage, dark urine, yellowing of skin, eyes, sudden weight gain or difficulty urinating. Renal side effects. Side effects in detail. Common side effects: nausea, vomiting, diarrhea, constipation, dizziness, headache, gas, indigestion, fluid retention or edema. Serious side effects: gastrointestinal bleeding or ulceration, heart attack, stroke, especially with long-term use. Hepatic toxicity: elevated liver enzymes, hepatitis, jaundice. Nephrotoxicity: acute kidney injury, elevated creatinine, anemia or thrombocytopenia. Severe skin reactions: Stevens-Johnson syndrome, toxic epidermal necrolysis, anaphylaxis or asthma exacerbation. 12. Vital information, monitoring and teaching. Monitor BP, renal function, and liver enzymes during long-term use. Educate patients to report unusual bleeding, chest pain, or allergic reactions. Avoid alcohol, GI bleeding risk. Use caution in elderly due to higher risk of GI and renal complications. Avoid combining with other NSR aspirin. Pregnancy category D, third trimester. Avoid lactation. Not well studied, caution advised. 13. Drug interactions. Increased risk of bleeding. Anticoagulants, e.g. warfarin, apixaban. Antiplatelets, aspirin, clopidogrel. SSRIs, SNRIs, fluoxetine, sertraline. Nephrotoxic combinations. ACE inhibitors, diuretics, e.g. furosemide, cyclosporine, tacrolimus. Other significant interactions: lithium levels and toxicity. Methotrexate, risk of toxicity. Cholestyramine may increase meloxicam clearance. Corticosteroids. Thank you. Have a nice day.